So as a doctor, as far as stem cell research and how it's progressed over the years, it's I would say the technology has advanced rapidly. The stuff they're able to do now in the laboratory shows great promise. The issue we're seeing is it's many times hard to get something from the laboratory bench to either the clinical setting or the operating room setting. So can we use stem cells to repair shoulder injuries? That's a great question. There is no formal papers that have come out that have shown that stem cells can actually end up repairing a full thickness rotator cuff tear. But there's a lot of anecdotal stories out there that do show great results where people have utilized stem cells. It can't bridge the gap, or at least we haven't been able to show it can bridge the gap of a full thickness tear when the tendon pulls off the bone. But there's some data coming out, and there's some stuff being done in clinical research where they're using scaffolds and other things to try to utilize the stem cells, plus some other devices to see if they could bridge a full thickness tear. We're definitely not ready to use that in the operating room. We're definitely not ready to use that in the clinical setting yet, but we think in the future that's probably going to be something that becomes much more commonplace. So we haven't been able to prove that stem cells can actually repair a full thickness tear. There's a lot of anecdotal stories out there, and hopefully we're going to see some better research coming out soon that shows it can work very well at times for potentially like a slap tear where the bicep attaches into the shoulder, or potentially a partial thickness tear where the tendon is still primarily attached to the bone. There's some good stories out there that show it can decrease pain, it can decrease swelling, and give you some better function. The other good thing about stem cells is it doesn't burn a bridge. So if you do stem cells, there's no downtime as far as there's no surgical downtime, and the risk to your shoulder is very low because we're using things that are actually being produced from your own body. The main issue we find when people come into my office talking about any of these adjunctive treatments such as PRP, which is protein-rich plasma, or stem cells, is the cost. Because these haven't been proven officially to work, no insurance companies are covering them. So unfortunately, some of my patients are coming in and they've gone to a stem cell location and they've paid $3,000, $5,000, $10,000 for a stem cell treatment, which is a lot of money to pay for something that currently doesn't have great proof that it's going to give you a high efficacy of success. I think if you're going to look into stem cells, I think you want to go with a company that has a good track record. A lot of people do stem cells. I think probably one of the best companies out there that probably has some of the best up and coming data, and they've been doing it for the longest, is Regenix. They're based out in Colorado. They do have kind of locations throughout the country. Once again, cost is an issue. So the other thing you want to do is once you get educated, most of the people are all using similar techniques. And the price ranges significantly. Some people will charge you $1,000, other people charge you $10,000, and the techniques almost everyone is using is about the same. So I think first you want to educate yourself on the process to figure out exactly what stem cells can and cannot do. I think you want to look into the person that actually is going to be doing the procedure for you. And I think anytime people give you stats or success rates, I think you want to dive into that a little bit deeper, because there's many people out there promising, 90% success rates, 95% success rates, and no one in the literature has been able to show that this is something that can consistently be achieved.